I've been a nurse for 48 years, and I love it. I absolutely love it. It was May of 2011, and I remember waking up one morning, getting ready to go to work. And I looked in the mirror and I thought, wow, my face is really red, and it feels tight. My primary care doctor happened to work in the same building as I did. So at lunchtime, I trotted over there and I said, hey, can you tell me, have you seen anything that looks like this? And she said, no, it does look kind of odd. Let's look at new detergents, new makeup, new, lotions, so on and so forth. And I couldn't really come up with anything, and neither could she. And even seeing the dermatologist, he did numerous skin punch biopsies, had me do light therapy and steroid injections. And I continued to see him for over a year. And during that time, it was getting worse and worse. I do remember it being itchy and uncomfortable. My skin started to shed a lot. It started to affect my skin from the bottoms of my feet that developed fissures, so the skin split. It was very painful to shower or even to walk. And I started to lose most of my hair. So I had my annual screening mammogram. And when the radiologist called me and said, we saw bilateral lymph nodes underneath both arms and there's multiple that are enlarged. I did talk to my PCP, and she said, I think it's time for you to see oncology, but I want you to talk to the dermatologist first. He said, have you heard of CTCL? I said, I have. I don't know much about it. It just stands for cutaneous T-cell lymphoma. He said, I think that's maybe what you have, and I want you to see oncology. So I saw the oncologist, and he said, the tests confirm you do have CTCL, and it's the more severe form of Sézary. So we started treatment right away. He put me on an oral chemo along with interferon injections and photopheresis. Even with all that, my skin was just, I didn't think it could get any worse, but it was. It was at that point that my oncologist said, you are continuing to decline. And I have a colleague at one of the university hospitals close by that is just beginning a clinical trial for Mycosis, Fungoides, and Sézary. So I met with this doctor, and he started to describe to me about this clinical trial that he was starting to initiate, and that medication is now known as POTELIGEO. We talked about the potential risks and benefits and decided it would be a good option for me to enroll. So after my first infusion, it was when we were on our way home that I started to have chills. And by the time I got home, I had a headache, I had fever, fatigue. We returned exactly 1 week later for the second infusion. And when I told them, they slowed the infusion down so it went in over 2 hours instead of 1. And they pre-medicated me with acetaminophen and an antihistamine. And that made a world of difference. After the fourth infusion, my husband and I both looked at my face, the rest of my skin, and I said, I'm cautiously optimistic that I think I'm improving. Over time, I had less redness and flakiness, and the bottoms of my feet softened and eventually returned to normal. So now my skin is normal on most of my body, and my lab work shows that there are no longer any Sézary cells in my blood. One thing I tell my grandchildren, and I think anybody going through this could learn from too, I tell them the 3 L's. You need to laugh every day, even if it's at yourself. You need to learn something new every day. And then you need to live your life. It's up to the doctors to save it, but it's up to you to live it.
POTELIGEO is a prescription medicine used to treat Mycosis fungoides, MF, or Sézary Syndrome, SS, in adults who have tried at least one prior medicine taken by mouth or injection that did not work, or in whom the disease has come back. POTELIGEO may cause serious side effects that can be severe or life-threatening, including skin problems, infusion reactions, infections, autoimmune problems, and complications from stem cell transplant. Call or see your healthcare provider right away if you develop any symptoms of the following problems or if these symptoms get worse: Skin problems. Signs and symptoms of skin reactions may include skin pain, itching, skin blistering or peeling, rash, painful sores or ulcers in your mouth, nose, throat, or genital area. Infusion reactions. Signs and symptoms of infusion reactions may include chills or shaking, redness on your face, flushing, itching or rash, shortness of breath, coughing or wheezing, dizziness, feeling like passing out, tiredness, fever. Infections. Signs and symptoms of infection may include fever, sweats or chills, nausea, flu-like symptoms, sore throat or difficulty swallowing, shortness of breath, diarrhea or stomach pain, cough. Autoimmune problems. Some people receiving POTELIGEO may develop autoimmune problems, and some people who already have an autoimmune disease may get worse during treatment with POTELIGEO. Complications of stem cell transplant. Patients who receive a stem cell transplant using donor stem cells, allogeneic, after treatment with POTELIGEO may experience complications that can be severe and lead to death. Your healthcare provider will monitor you for signs of complications if you have an allogeneic stem cell transplant. The most common side effects of POTELIGEO include rash, tiredness, diarrhea, muscle and bone pain, and upper respiratory tract infection. Before starting POTELIGEO treatment, tell your doctor about all your medical conditions, including whether you have had a severe skin reaction after receiving POTELIGEO, have had an infusion reaction during or after receiving POTELIGEO, have or have had liver problems including hepatitis B, HBV infection, have a history of autoimmune problems, have undergone or plan to have a stem cell transplant using cells from a donor, have lung or breathing problems, are pregnant or plan to become pregnant. It is not known if POTELIGEO will harm your unborn baby, are breastfeeding or plan to breastfeed. Talk to your healthcare provider about the best way to feed your baby during treatment with POTELIGEO. Tell your doctor about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. You are encouraged to report suspected adverse reactions to Kyowa Kirin Inc. at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.